Welcome to the JOMA Preventative Health Podcast, hosted by the Jewish Orthodox Women's Medical Association. We provide you with up-to-date information on health topics geared towards the Orthodox Jewish community. This podcast content is provided for informational purposes only and is not intended as medical advice or as a substitute for the medical advice of a physician.
Welcome to the Jewish Orthodox Women's Medical Association, or JOMA podcast. I'm your host, Elissa Hellman. I'm a general pediatrician and proud JOMA member, and I am super honored and super excited to be interviewing another proud JOMA member, Dr. Elissa Hellman, who I already had interviewed way back in October 2020, who has founded the Confident Kallah. And so this is part 2 of that after the Chuppah. So before I complete my introduction of Dr. Hellman, I will say, please reach out to us on health@joma.org if you have comments, constructive criticism, thoughts, ideas about other topics, especially if you are a speaker or you know a speaker who would like to be interviewed. I'm very open to that and interested in your thoughts and ideas. So this is just as a heads up, this talk will be for mature audiences. It contains sensitive and occasionally explicit material. Dr. Hellman is an experienced board-certified OBGYN. She has been in practice for over 10 years in Milwaukee, Wisconsin. She received her medical degree from NYU and completed a residency in obstetrics and gynecology at North Shore Hospital in Manhasset. She's also the physician at the Confident Kallah, a telemedicine gynecology practice focused on the needs of Jewish women who observe Taharat Ha'Mishpacha. Throughout her years as a clinician, she noticed a gap in women's health awareness and education. This developed into a special interest in patient education and being a resource for the Jewish community in relation to body awareness and women's preventative health, starting from a young age. Welcome, Dr. Hellman. Thank you so much for joining me today.
Thanks for having me.
Oh, I'm super, super excited. So, I looked back, we did our first talk, the Confident Kallah, back in October 2020.
That was a long time ago.
That was like a millennia ago.
Right?
And it was super, super popular. And I realized, that we talked about a lot of important things. We talked a lot about healthy body image. We talked about appropriate basic health education for our daughters. I also, by the way, interviewed Rachel Tuckman and Elissa Hellman on talking to our kids in general about sex. So people can listen to that if they want to hear more about that. But our talk stopped at the wedding, right? At the Chuppah. Right. And so I want to pick it up from there. And I want to give the caveat that, first of all, none of these talks constitute medical advice. And also we do not tackle halacha. You can go to your physician for, actual medical advice and go to your local Orthodox Rav for halachic advice. And one more caveat that this talk may contain sensitive and occasionally explicit material. So it's meant for mature audiences. So I'm going to let you start with the wedding night.
Right. Okay, we're going to jump right in. So, I think one of the things we had talked about with the last time is really feeling comfortable and being able to talk with your children, daughters, we're kind of, I think I'm a little bit more focused on girls, but for sure boys also, about just like understanding their body and their anatomy and what's normal, what's not normal as far as like what's on them, right? And how their bodies act just like with their periods and pleasure and things like that. But then, with that background, now we're kind of like applying it, right? Because now, and we're kind of having this discussion in context of like an Orthodox Jewish lifestyle where many women will wait until marriage to have sex. And because of that, like waiting, it can be nerve-wracking, it can be exciting. There's probably an element of both in there. Usually at the point you're getting married, you're engaged, you're getting married, and you're kind of excited, you're attracted to this person, you love this person, and you do want to engage in sexual behavior with, your new spouse. But it can be also kind of nerve-wracking, like it's just the unknown, right? You don't really kind of know what to expect, and compounded by we don't really talk about it so much. It's not like, the girls sleepover, like topic of discussion all the time as someone's growing up, right? That maybe in other cultures, it can be kind of scary. So I think that's kind of like how people or how women like kind of come in to their marriage of like, I don't really know what's going on, but like, I do want to know. Right. So I think that's kind of the approach that people kind of start with.
Right. And I also think that there's also a societal expectation heaped upon the new Kallah.
Yeah. The way I see it is, everything's in this like perfect little bubble, right? You dated, you got engaged, you're getting married, and everything should go great, right? Everything's going great up until now. Everything should go perfectly. And this is a natural thing. And our bodies are just, we respond to like attraction and have those sexual urges and feelings. And great, we found the right person at the right time and everything's like allowed now. It should be fine, but it's not always fine. And sometimes it is amazing, right? So I think there's this kind of like general feeling out there of, I do want this to go really well, but I'm kind of nervous about it. So how can I help myself like make that happen and go well?
Right. So what kind of advice? I know you do this. This is the counseling you do as the Confident Kallah.
Yeah. So I think,
Share some tips with us though, because everything with anxiety is knowledge is power.
Definitely 100%. And I think that, number one is just education and like kind of knowing what to expect. And I think there's a lot of fear around like the actual act of sex, as far as like penetration goes. And I think that one way that I will talk to new Kallahs about that is to feel comfortable with like the internalness of their body and inside the vagina, practice with tampons and, go to the doctor for a gynecologic exam just to make sure everything's okay. So you can kind of have that reassurance that there aren't any like anatomic reasons that this should be difficult. And that I think it helps. It's not perfect though, right? And another thing that I bring up when I talk to Kallahs is it's different though, right? Like when you are in a bedroom alone with someone you're attracted to and love and you're excited to be doing this, your body responds differently than when you're in the bathroom putting a tampon in or at the doctor's office getting a speculum inserted, right? So your body does, goes through changes, physiologic responses, your vagina lengthens, it becomes more stretchy, more lubricated, right? So your body knows what to do to help make this happen at least as comfortably as possible, which is different, but at least the kind of practice part, I guess, of the, feeling comfortable with where your vagina is even, right? That's sometimes even a basic step that is confusing for people if they never like looked or know, to kind of get over that part to kind of have that understanding. And then it's like, okay, now I know the mechanics of it and I understand what's going where and what happens to each part of the genital region during sex that, you have a little bit more kind of less anxiety about it because you know more.
Right. One other thought I had, and I've heard talk about this, is when I said societal expectations, meaning that the expectations on your wedding night, you will have sex with your husband.
Right.
So I'm wondering what your thoughts are on that. I know there's some talk of, well, let's remove that expectation and remove that pressure. Not meaning you shouldn't not do it. I've heard one opinion that you shouldn't intentionally, you should wait, but that's controversial. And we're not talking about that. But just in terms of removing the anxiety and pressure that could involve.
Right. I think around that topic, I think we need to get away from, there's a rule, either don't or do, and the rule in halachic Judaism, and I know both of us are not halachic experts, but we live a Orthodox lifestyle, so are familiar, is you found the right person, you're at the right time, at least in regards to like your menstrual cycle and bleeding, and been to the mikvah and, wherever you are in that, like that's the halacha part of it. But as far as like, if you have to, or if you have to wait, or if you have to have sex on your wedding night, I think we need to take away those absolute rules. Entering into a marriage with someone, you're kind of committing to have a sexual life with them, right? Otherwise you probably would not be with them and under the chuppah. So it's something that you have, no one wants to have a first sexual experience with someone feeling forced. And you want to feel comfortable, and both of you may be learning together. One or both of you may have been experienced in this from previous, situations. And there can be like kind of an imbalance in that, but to feel like you want to do it is really what should be kind of like the overarching feeling of having sex with your new spouse. And that may be something that you want to work up to and like build up that excitement now that you've gone to like never touching a boy in your life to I'm completely undressed and like having sex, right? Like all in a, 24-hour period. That can be really like kind of scary. So it is, I do like to stress, like, it's okay to ease into it. It should happen eventually, right? And if it doesn't, so that's something like, where's the issue? Where's the problem? Like, what's holding you up? Like, you want to, why is it not working? So that may need attention. But to feel like it has to happen, like when you're hot and sweaty and exhausted and you just had a big wedding and, you want to just kind of rest a little bit, or just kind of explore each other's bodies, or just touch each other in places or at all, or just kiss, something you've never done before. Like, it's okay to ease into that. That's actually really normal, even in the secular world. Like, it may start a little at a different time of your life, but it's normal to ease into that type of physical behavior, and activity. And that's fine for us too, and it's normal. It may be sped up a little bit because you get excited at one point, right? Because you're allowed to and able to. It's kind of approved, but it definitely is not something that you should feel like forced into, and you should never be having sex if you don't want to.
Right. So that's a really perfect segue into consent, because that can't be underscored enough. Just
right.
Because you're married doesn't give automatic access to you.
Right. And I think that, because our months are, if someone's not on contraception and they're on their normal, or even if they are and they're not on normal, they're on their regular monthly cycle, right? There are parts of the cycle that we halachically are not able to have sex or even touch. And so, of course, when that's over, like, of course we must want to, like, let's get it all in those 2 weeks before we, get our periods again. And there can be kind of that pressure to feel like, hey, I'm kind of not really in the mood, but I think I have to, right? Like, he's been waiting for so long, or, those thoughts can kind of come in. Is this something to talk about with your spouse, to be like, hey, I don't really feel in the mood at this time. Like, is there something you guys can do together to like get you more in the mood if you kind of want to, or he wants to, great, you can have that discussion. But right, even because you're with the person who you're permitted to be having sex with, you still need the permission, both from yourself and from him to engage in that behavior too. You just may not feel like it, and that's okay.
Right. Now, that's really important. So what about when the couple is actually unable to consummate the marriage? Let's go there just for at least a little bit. I don't want to go there too much, just because, I don't want to focus too much on the abnormal when right. Most of the time it is normal.
Right. And I think that's super important to stress. Like, I think in the past, whatever, I'm not going to put a year number on it, but we definitely are more open now, I think. And we're starting to talk about more issues that usually were more behind closed doors, and so many different areas of private lives, right? And sexual activity definitely being one of them. But, I think we forget, like, when we start hearing about all these things, that must be what everyone is experiencing, because now people are coming out of the woodwork and talking about it because they feel like more supported and able to. But we can't forget that still the usual way and it's usually fine, right? Like there's problems, there's pathology, there's situations that need help and treatment, but that is not the norm. It's just that we're hearing about it more because people are thankfully more like have more resources and more support and more ability to talk about it. But having normal sexual activity with your spouse, because remember, it is a normal process, right? Like just like a baby learns to walk, or, or you end up getting your period because your body's gone through puberty. Like having sex is right? Like just evolutionarily, like, hey, like this is how we procreate ourselves. So it is a normal act, and it's something that most people are able to do without issue at all. There can be different times in someone's life, like a woman's life, like postpartum, menopausal, perimenopausal, things like that, where things, there's a medical reason that it can be uncomfortable or difficult. But normal is normal for a reason, right? Like it definitely, we can't forget that.
Right. Normal. And I just want to say also that with all this awareness of the more serious problems, we shouldn't think just because we have a blip, a difficult time learning how to do this in the very beginning, that's the same thing as a serious problem.
For sure. Right. And I think it's important, like when we frame it in, okay, normal is the usual, right? Like it works. So what happens? So like, what's the time frame? Like where do we judge like where something is wrong or we need to kind of get attention? So, and I usually kind of, when I see a Kallah, I'll kind of talk to them like it may be uncomfortable. It may hurt. You may have bleeding. Like it's kind of expected for some people. Don't think something's wrong if you don't have pain or if you don't bleed. That's honestly what I get more like, how come I didn't bleed? What's wrong with me? Or it didn't hurt in the beginning. Like, what's wrong with me? So that's great. Like, good for you. Nothing is wrong with you, and nothing's wrong with you if it did. But I'd say in that pain and discomfort and bleeding is usually due to a penetration of the vagina with something bigger, penis, that has never really, something that size has never really been in there, right? So the tissue needs to stretch a little bit. And it's made to stretch. The vagina is made kind of like, really elastic, lots of folds in it that you can't really see or feel, but it's made to kind of expand because of that. And so that's where that stretching discomfort or a little tissue tear that may cause bleeding comes from. That shouldn't happen all the time, maybe the first few times. And pain is our signal that something is not right. So if something is if it's continually painful and that never gets better, that's your sign that you should go to a doctor and get an exam or talk about like what are ways to make this better. So that's I'd say is probably the most common of the, hey, something doesn't feel right. Let me try to fix it in kind of a minor way. I'd say that's more a common minor problem that new Kallahs will have. Then there are situations where like it never happens, right? Like a year, 2 years, or like sex is extremely painful, or like they've been married for a while and they just can never, ever make it happen because it is either so painful or they're just not sure what to do. And that I think requires a little bit more investigation,
Right. How long would you say to wait though? Not a year or two.
No, not at all. A few weeks, I think. There's a difference between unable to have penetration versus it happened, but it's uncomfortable or there's bleeding in the beginning. And that usually gets better with, after a few times. But after a few weeks, if everything physiologically is working, like if he has an erection and you feel aroused, right? Because there's also the mental part of it too. That's really important in the whole process. And penetration really feels impossible. And it's been a few weeks of trying, like subtract the NIDA weeks, right? When a woman is bleeding and she can't, right? So I wouldn't count that in the trying. But, if you've tried, like it's really, I think, worth it to go see a gynecologist and kind of have those discussions. And a gynecologist, I think, is the first good stop. It doesn't mean it's the last. And, pelvic physical therapists, I think, are probably the main experts in pelvic floor function, right? Like as a gynecologist, I can kind of diagnose, or I can feel like, do I feel like increased muscular tone, or are there issues with insertion and penetration? But can I treat it? No, I'm not trained in like the muscles of the pelvic floor and function. And that's when your gynecologist say, you know what, like, it does seem like there may be an issue here. Let's refer you to a pelvic PT. If your gynecologist doesn't say that, refer yourself, like that's okay. You can like hook yourself up with a physical therapy office that has a pelvic specialist and kind of get the help you need. And they are beyond helpful. I mean, it's a field that is incredible. Like every day, I'm just so thankful for it.
Right. And I interviewed Rifki Chudnoff, who's an amazing PT. So if people want to hear more about that, they can go back to that talk.
Yeah, for sure.
So that's really important. What about the role of a sex therapist?
So I think that's also a good idea. I do like to start with, and look, obviously I'm coming from my MD perspective of like, I am definitely more medical focused. And I think it's good to kind of start with the physical and say like, is there a physiologic or a physical problem, anatomic problem, something that's like easily treatable within a few sessions, or like we can diagnose something and work on that. And that alone can sometimes be validating and like, okay, there is something that like needs to be fixed. Let me work on it. And I have hope for the future that it's going to get better. If there is also though, a really, I think, big anxiety component, I'm so scared it's going to hurt. It still hurts even while I'm in therapy. How is this affecting my relationship? I'm trying staying away from him because I don't want him to initiate because I'm so nervous about even trying because I'm going to be in pain, right? When it's that whole cycle, and when it's really kind of affecting the relationship, I think that's all when together, not separate, right? All these therapies work together. So having a sex therapist, kind of give ideas while you're also undergoing pelvic physical therapy, while we're making sure that there's nothing anatomically wrong, right? So I think that's when it's kind of appropriate to go then do that extra therapy.
Right. And even extra therapy would be a regular therapist if you also have experienced trauma, for example.
Right.
Right. I mean, these things all overlap, right?
Oh, for sure. I mean, depending on each individual person, there can be so many different layers to why there is a problem. And again, not everyone who had trauma is going to have a problem, so that's another thing of yes, if you had a bad experience before, that doesn't mean that this is going to be horrible. You may feel super safe in this new relationship that you've committed to, and things feel a lot better and you're okay with it. Right. So don't assume things are going to be bad from the beginning.
Right.
But yeah.
And what's really amazing is we have from people in all these professions.
Oh yeah.
Right. This is very specific, right?
Right.
To our lives, our halacha, our culture, all of these things. You want someone who knows that.
Right. And I think, even if you can't find one, I mean, not everyone lives in a place where you can get that. Sorry. And that's okay. It's me sitting in the Midwest. But
I think everybody has everything.
Exactly. It's also okay to tell your doctor, it's actually it's so, I don't know, a sense of relief when someone's oh, but I can't do this for this reason. I'm like, oh, okay. Thank you so much for telling me. As a doctor, I can take care of you better and I can understand you. And I can tailor my discussions with you as who you are in the life you live so much better, right? We're not just here to prescribe stuff and have you do some exercises, right? We're treating you as a person, and we kind of have to know that. So it may feel weird to be hey, 2 months of the month, 2 weeks of the month, I can't have sex with my husband. I know we're married, but I know that sounds weird, but it's not weird in my culture, right? So if you kind of have the, I guess, confidence almost to be to just explain your life. It's not anything that's, out of the ordinary. Everyone has something interesting in their lives. And, most people know about Jews. They may not know the intricacies of what Orthodox, private sexual life with, your spouse means, but tell them, educate them. And that may even help someone else, down the road, but you shouldn't feel you have to hide that part of you, especially if it's so integral to the problem that you're having. Hey, this is my background. I got married and, you're sitting there late 20s and I never kissed a boy before. Don't be ashamed of that. that is your culture that you grew up in. Like, there's nothing to be ashamed of.
Right.
And no one, like, your doctor's not going to judge you. So it's okay to, if you don't have a from person, to just explain it to the nurse.
Right. That's really important. And also not only that, but there's many people who don't feel comfortable going to other people, say maybe from their community for the sensitive issue.
For sure.
So even if you have access to it, you may choose not to. There's an amazing resource, and I'm blanking out on the name of the organization that has so much education that can be used by physicians who don't know about it. They just had a big conference. Why am I blanking out?
Taharat.
Well, Taharat, by the way, is an amazing resource for people who also want halachic based advice. Taharat was amazing, but I'm thinking of another organization, not Nefesh. They just had
Nishmat.
Yeah, so close.
Yeah.
Nishmat. So Nishmat they had a whole course. I took part of it.
Yeah.
To make physicians more culturally knowledgeable.
Right.
It's so important.
Yeah. Yeah. And it's that's okay. Just don't be ashamed of your life and just explain it so that your people taking care of you can take care of you in the best way that they can.
Right. Forget being ashamed. Be proud. Be proud.
Right. Exactly.
Culturally competent care, no matter what your culture is.
Right. Yeah.
So that was I'm so glad you said that.
Yeah.
Okay. We're going to go totally in a different direction. We're going to talk about fertility awareness.
Okay.
Right.
Great.
We are now going smoothly with our relationships.
Okay. Right. Things are going well. Sex is happening. Right. Right. And I think that kind of, and this is a discussion that I do have with Kallahs because, and it also really, it's important to talk about before marriage and also during dating too. And this is something I even talk about in a little bit of a different way with like a puberty talk with like middle school girls, right? You may not have to like worry about when you're ovulating so that you can get pregnant, but be aware of your cycle. How long is it? How long does it last for? How many days between periods? Like that's really the basics of fertility awareness, right? If you can figure out when you're ovulating, you can figure out when to have sex to conceive. And then once that piece is kind of figured out, okay, why am I not getting pregnant? Or how long should I be waiting to be before I'm concerned that I'm not pregnant, right? So we have to get the timing right? We have to figure out, are we ovulating? When are we ovulating? And then kind of move on from there if there's a problem. So, the fertility awareness piece is just super basic, regular 28-day cycle. And that's kind of like normal average. Not everyone has average, but you usually ovulate 14 days before your period. So that would mean on a 28-day cycle, 28 minus 14 is 14. If you have a longer cycle, right, like 5 weeks from period to period, you'd have a 35-day cycle. Subtract 14 from that, you'd be ovulating on day 21. So if you know when you're ovulating, you can also kind of see where it falls out when you go to the mikvah, right? Because if you're not having sex while you're in nida and you're ovulating before you're halachically able to, that's also something to be aware of. Like maybe medically everything's fine. You're just ovulating a day or two beforehand, and that's why it's not working. So things to think about your cycle in context with when you're having sex. That's really what fertility awareness is. And then also taking into account your health status, any medical issues, medications, age, family history, things like that. As far as like, are you successful at getting pregnant? Like, is it happening, right? How long do you wait before you worry? In a generally healthy under 30-year-old woman, I'd say it can take a year to get pregnant. And people get super anxious at like the 4-month mark, really. I'd say it's like, okay, 3 periods, 4 periods. Oh my God, what's going on? Like, I'm not pregnant yet. And that can be kind of a reassuring number, right? To hear like, okay, most, 90% of couples will get pregnant within the first year. Right? More than that even, and 75% within the first 6 months. But what about the rest, right? Like that takes a little longer. And that's to understand that something is not wrong with you because you didn't get pregnant the first time that you had sex during ovulation. Like that's okay. That's pretty normal. And just kind of having that understanding. And if you are super anxious about it because you're not getting pregnant as soon as you thought you would, to kind of be a little bit more scientific about it. Start doing ovulation kits. That's something you can just buy at the drugstore on your own. Like, try to figure it out on your own, or see your gynecologist and talk about it. Maybe you just don't have a full understanding of exactly when you would be ovulating or what your cycle is like, but you can, sometimes just the understanding of it can help you get pregnant.
Right. What about people with irregular cycles? You're assuming a regular cycle with that information.
Right. So irregular cycles is usually an indication of less ovulation. We get our period because we don't get pregnant from an ovulation. And so if you don't ovulate, that your body is just kind of like stuck in that phase of the cycle, and there's no signaling to get your period. So that's why what's called anovulatory cycles is usually which is what irregular is, right? Like every 2 to 3 months or even more than that, you're not ovulating. Most of the time, that's what it's from. So that's if that's something that you've noticed even before getting married, right? Like, hey, this is what my pattern is. That's when it's a good idea to kind of almost make a plan ahead of time. Like, hey, I already know I'm coming into this marriage and wanting to have children with this person. Before you get married, there may be an ovulatory issue. Great. So speak with your doctor beforehand, make a plan, right? Like, if I don't get pregnant in this many times, or if I don't pick up ovulation, or if I don't get my period within, 3 to 6 months or whatever of wanting to get pregnant, what's the plan? Are there medications I can take? Are there, other therapies or testing that we can do, to kind of get on it ahead of time, because I already know that there may be a problem, as opposed to starting the process then, because all this testing and blood work and figuring it out can sometimes take, a few months. So if you want to get on it ahead of time, that's also a conversation that you could definitely have before you're even trying.
Right. When I was talking about, regular, I wasn't thinking every 2 to 3 months. I mean, if you're having your period every 2 to 3 months, that's not normal.
It is not. No. Yeah. But that's some, and the people may like that though. People may be like, yeah, like, I don't really like having my period. So the fact that I get it every 2 to 3 months is actually like great. Like, I'm fine with it. And then you want to have a baby, and that's when it becomes not great, right? That's when it becomes a problem. So you may not even be so clued in that this is not normal, or that you should care that it's not normal. Yeah.
Right. But that's important. Like, even before marriage, if you know you're having some kind of problem, look into it, even if you don't perceive it as a problem. If nothing else, we're bringing awareness that this could be a sign of a problem. But what about just if your periods are sometimes 28, sometimes 35, they're not every 28.
Right. So if they're like off by a few days here and there, that's usually not, that's not such a huge deal. Especially if your ovulation is happening after mikvah, because assuming you're sexually active, and you're trying to get pregnant, so you're probably having sex more frequently to make that happen. You are able to, like, ovulation should happen sometime in the time that you're able to have sex. So even if it's day 14 one month and it's day 20 the next month, you should still kind of cover that ovulation potential time. And there definitely can be variation in one woman with her cycles. Like, it's not always exactly clockwork. Every 27 days perfectly at noon, I get my period, right? So that's normal, and that's okay. It's more when we ovulate before mikvah and before we're allowed to have sex that that's where we have that halachic infertility. And that's something that should definitely be discussed with your halachic authority and with your doctor, because there are definitely solutions to that.
All right. And Taharat is amazing for that.
Yeah. So, yeah. No, they're great. Mm-hmm.
Yes.
Yeah.
They also should be asked for help. Okay. So that's all really, really important. What about if someone doesn't want to get pregnant? And again, we're not giving halachic advice here. So
right.
Halachic authority.
Right.
But not from a gynecological perspective.
Right. So from the gynecologic perspective, which is pretty much most of what I do, is prescribe birth control and talk about that. Birth control would be the way to prevent pregnancy. And whether it's something that you're just, whether it's hormonal, whether it's non-hormonal, whether it's you're just using like cycle awareness and avoiding sex around your fertile time, or using a spermicide or something. Sorry for the noise. Then, that's something that that you talk about with your doctor, as far as like what methods are right for you. And the way that I kind of end up having these conversations with new Kallahs is, what are your plans for pregnancy? Have you talked about it with your chassan, with your groom? Have you talked about it with your rabbi? Like, have you guys come to a decision? And I think more so nowadays than previously, couples are waiting a few months, just to kind of ease into their new lives together and make sure that, they're happy with each other and things are going well and that there's not problems right in the beginning before bringing a child into the mix. Kind of with the attitude of, I'm just for a few months, but I am committed to having children. Right. And that's, I think, one of the, Orthodox Judaism definitely condones that as, like building families. Right. So, I don't think anyone's really going into a marriage saying, I don't ever want children. People do have those thoughts. I'm not so experienced with that in my work, but, a temporary time is I think okay, right? To kind of ease in. So then, like, what birth control method works for you? Like, do we want short term, right? Because you guys do want to get off of something in 6 months. Do you want long term? Like, do you need spacing between children? Are you having cycle issues that you need treating?
I just want to say one thing before you go more into detail about the contraception, and that, yes, we don't just condone having children, we uphold it. It's extremely high value, but no individual should be pressured into thinking that they have to do something because their circumstances might be that they are not ready to have children.
Right. And the home life in Judaism is we want it to be a happy and healthy one. No one's asking you to have 10 children when you're like mentally not able to, right? Like that's not
reason one.
Right. And it's so I think we have to kind of be careful with that understanding of, like, if you're not going to go on birth control and you are ready to get married, that also means you're ready to have children, right? And I think, or I'm not, and some people will use non-pharmacologic methods, and that's fine. But I'm just kind of, that's the perspective that I think some Kallahs may not always understand. And that's part of my conversation of getting married also means potentially being pregnant in a month. If you're not using anything, like, are you ready for that? Is that something you've thought about? Is that something you've discussed? Because sometimes it can be hard to discuss with someone who you've committed to being with this person, but you may not know them so well because you had a short engagement or short dating, and everything matches up well and you're fine. But do you even feel comfortable having that conversation with your fiance who you may not even really know so well yet? It's a hard conversation to have. But it should happen, right? Because it greatly affects both of your lives. So I think that's an important thought to have of, like, yeah, I'm getting ready for my wedding and I'm setting up my new home, but I could have a baby in a year. Am I ready for that? And if you are, wonderful, great. And if you're not, think about, when do you think you would be ready? And then work on preventing pregnancy in a way that works out for you and you holistically feel comfortable with. And that's a conversation that I almost find people need to feel empowered with. Mm-hmm. It's not something that I think comes naturally, especially because we, the 2 months after you're married, you feel like everyone's looking at your stomach and like, okay, are you pregnant yet? There's also this, even though I think it's kind of backwards, but I think internally we are helping our new brides become more comfortable with feeling ready. Yet externally, we still have those people looking at your belly and oh, I feel uncomfortable. I'm married for 6 months and I'm not pregnant yet, even though I don't want to be, and I'm okay with that. But all my friends are, and all my friends did that. So I feel almost pressured because everyone else did, because that's what's expected. So there's a lot of kind of nuance behind that. So I think we also need to be a little bit better as a community and not expect the usual, or what we think is the usual of what should happen when, right? Everyone has their own lives. Everyone needs to do what's right for them. And just
Right.
kind of back off sometimes.
And if we got off the body focus in general, that would be helpful in so many ways.
Oh, of course. Yes. I think we have a long way to go.
Just don't even look at the body. You're good.
Right. Exactly.
Don't say it. Don't look it.
What?
Don't say it. Don't look it. Right.
Exactly. No comment. Just look at my eyes when I'm talking to you. But yeah, that's, I think that's kind of, an important thing to think about, is the children piece of it too. And, I've had some people ask like, oh, but is birth control like halachically okay? And I'm like, you know what? Pretty much, I think anyone I've ever spoken to has never been told no. They may have been told like, okay, what time frame works for you? Like, can you just be in birth control for 6 months or a year, or let's reevaluate at a certain time. Right. But anyone coming to a rabbi asking for kind of permission for birth control, there's a reason behind that. And people, there's definitely, it can be the mental, I'm just not ready. I feel stressed. I don't feel like I can handle another baby at this time. And that is a huge factor to saying, okay, how much time do you think you need? Or let's reevaluate at this, 6 months or a year or 2 years or whatever it is, whatever experience you went through with like your last baby or whatever, coming into a marriage, whatever experiences you guys have that you feel like you may need time to wait before a pregnancy. I feel like anytime someone asks, there's a reason for the asking, and the vast majority of rabbis will understand that. And if they don't, have the conversation, be like, I don't think you're understanding me. This is why I'm asking. I feel like pregnancy would be unsafe for me right now, or it would really add a lot of stress onto my new marriage, or would add a lot of stress onto my already growing family. Don't have the conversation. Don't just accept it if you feel uncomfortable with it.
Right. I think that's really important. And I'm just thinking that it takes a lot of self-awareness and the ability to advocate for yourself.
For sure. And that's the reason we're having conversations like this, right? Is that's okay. And no one, I don't want to say no one, it's just not fought for enough. Right. Being a Kallah especially is such a busy time, right? Like you're planning a huge party, you're setting up a new home, you have to do a million, and you have your regular life that you're doing if you're in school or if you're working, right? It's a lot. And there's so many parts of this new life that something like this, I think it's like the after, and I think it kind of gets pushed aside and no one really talks about how important that conversation is, but it could be one of the most important conversations. Like, who cares about your flowers, right? Who cares about the food at the wedding? Like, this matters. Like, this is important, right? The food matters too, but it's, but don't let these important things get pushed aside, because they're life changing.
Right. And don't be afraid to advocate for yourself, and also to value your mental health. I mean, we haven't mentioned mental health as being a reason for family planning. We're so much more aware of the need to take care of our mental health. We're so much less stigma. Thank God. There's a long way to go. But that could be a very good reason why someone would need possibly a prolonged period.
For sure. Yeah, definitely. And, do you take any medications that you need to wean off of? And you feel like you need to be on during the wedding because it is a stressful time, and then you need to wean off of it to safely be, get pregnant. Do you need to work through some things, beforehand to feel like you're able to take care of another person who's 100, right? Your husband's not 100% dependent on you, but your baby is, right? So it's a huge life change. I always tell everyone, every new mom that I see as my postpartum visits and any friends, the hardest thing I have ever done in my entire life is have my first baby. It was in a second, what else do we go through where in a second your life changes and there's no going back, right? And it is the hardest thing, and it could be an amazing, wonderful thing, and it is, but it is so hard. And I don't think we talk about that enough. We don't, and we're starting to, I think, but, the needing support as a new mom and all these things that kind of come with that, need thinking about, especially because you just started your new life with your husband too, right? There's so much newness all at once. Sometimes it's helpful to feel adjusted and comfortable where you are before, like another big new change.
Right. It's so, so true. And I'm thinking, like, we didn't say medical conditions. You could have a medical condition when you're not, ready to be pregnant. You're on certain medications or in certain parts of your treatment. And I think that no one would hesitate to go to a Rob, to discuss it with them. And then for your mental health, I think we do have more hesitance. I think we don't necessarily respect our, emotional and mental health needs the same as our physical health. And we also don't necessarily have objectivity. So like what I'm thinking as a big mental health advocate is get your therapist or get your psychiatrist on board with this to give you an objective feedback as opposed to trying to just wing it on your own.
Right. It's always good to have that like outside perspective too. And that's kind of what I try to do with, I'm obviously not a mental health professional, but I do try to kind of like just bring up that conversation. Like think about it. That's all. Like think about it. Like, do you feel okay? Like if I handed you a baby right now that you were taking home with and taking care of forever, would you be okay with that? And if the answer is like, oh my God, that sounds really scary, or like, no, okay, think about that, but the thing with mental health too, is sometimes we don't know until it happens to us, and I think that's the hard part, too, of like this deciding, being like really kind of, specific and deciding about, okay, I'm ready for a baby now. Okay. You totally could be. And if you're kind of like, whatever, like I'm fine to get pregnant, or if it takes a little while, that's fine too. You may not realize like where you're at until something challenges, your kind of mental health or stress level, so that's definitely a nuance to this conversation. That is really, I don't know, I don't have it fully formed in my head right now, but, I think we have to kind of recognize that too. And if that's the case, like, build your support system like before. Like, do you live in a place where you have no family and no support? Like, is that the best thing for you when you're starting to have a family? Like, what are the things you need to like set yourself up for success, in this area?
But I was referring to people who have pre-existing health conditions.
Yeah.
And understand that you need to respect your mental and emotional health, just like you do your physical.
For sure. And I also, I'm going to use it's not something we talk about enough. But I think it's really important for people who are maybe on any psychiatric medications to have a discussion with a reproductive psychiatrist. There are many obstetricians, there are many regular psychiatrists who have kind of a fear of combining pregnancy with psychiatric medications. And there's so much new research out there. There's, you don't want to go to a psychiatrist who says you have to be off of everything. And you don't want to go to an obstetrician who says you have to be off of everything because you're pregnant or you want to be pregnant. That is not true. And it's something that, and I'm not finding fault with anyone specifically, but there's so much new research on pregnancy and psychiatric medications and how it's leaning more towards a lot of things you actually can stay on because it's better for, like, we take everything away from someone who needs them, and the pregnancy is actually detrimentally affected because of your mental state, not because of medication. So it's really a risk. Everything is a risk-benefit decision. But I think reproductive psychiatrists are much more kind of comfortable talking about what you can stay on, what doses, what are good substitutes if you have to get off of something, without saying no to everything that can spiral you downwards. So, yeah.
This is really, really important. And by the time this talk is released, there should have been one released with Dr. Tal Weinberger, who is a reproductive psychiatrist.
Awesome. Perfect. That was the segue. Yeah.
It was a segue. I came up retroactively. But I'm so glad you said that, right? Because there's this fear of taking toxins, while you're pregnant, and it really is a risk-benefit,
Definitely.
Equation, and you need to. And I'm also a big proponent of working together, multidisciplinary, and this is something that you really need a multidisciplinary approach.
Oh, 100%.
Both your psychiatrist and your OBGYN together.
Right. And I think from the OB perspective, we feel much more comfortable when we have that psychiatrist, like, I don't think we know the ins and outs of every psychiatric med as much as psychiatrist does, for sure. And we definitely feel more comfortable when we have that person who gives their expertise on that. And I think it's also just reassuring for a patient too, to like, I have a team taking care of me, and that's, I feel good about it. So.
Great. And you can create the team yourself, because it won't necessarily happen. I mean, I can say this as a pediatrician. I'm always constantly trying to talk to specialists, and I have to get the parent to have consent. There has to be work on the part of the patient themselves, is what I'm saying.
100%.
Please speak to my reproductive psychiatrist. I'm going to give consent, because anything with mental health, there's a whole other layer of confidentiality. Sign that consent, work on it so that they will talk together. It's not going to just happen on its own.
Right. And then if you feel like things aren't going well, also, like you need a adjustment on your meds, you need some extra therapy, or things aren't going well, like you have to tell us. Like, we don't always know, right? You gotta like kind of advocate for yourself. We can't always read minds.
Right. You know what? We had so much more to talk about, and there's no way we can do any justice to contraception.
I'll see you again, I'm sure.
Yeah, find you. Yes. Anything else you want to add? We did get a question that I feel like we should address, because whenever we get questions, I want to answer them. Someone actually asked a question about altering your cycle with like lemon juice or something like that. It was some homemade remedy to either shorten it or lengthen. I don't remember which was the one that they wanted, but trying to alter your cycle.
Yeah. So I can say right off the bat, there are no great studies proving that will work. Where I think it's coming from is, lemons are a citrus fruit that have high vitamin C in them. And I think that there is a recommendation out there, especially by like, college teachers or rabbis or yoetzets, to high dose vitamin C can help shorten the bleeding time. Like if someone's having prolonged spotting, or they're having long periods and they want to get to the mikveh earlier, or whatever it is, just take some high dose vitamin C, and that should work. So I think that's kind of like where that question, the connection to that question is. There are no studies like proving that works. Does it? I don't know, because I don't have any like evidence to back me up. Will it completely alter your cycles? Absolutely not. There is nothing that will alter your cycles other than hormonal medications. There are other medications out there that will lighten the flow. It's called Listida. There are medications that, can, like things like ibuprofen or things like that can lighten flow, but it will not change your period. Your period is still going to come, and you're still going to be bleeding. It's not like a birth control pill where you just like skip the placebo week and you skip the period. And that doesn't even always work for someone, right? Like your body's still going through its normal thing, its normal cycle. And like lemon juice cannot change that, right? Or else like everyone would have irregular cycles just by drinking lemonade in the summer, right? It's something that I think there are all these little things out there that are not harmful, right? So I'm not going to say don't do that. That's stupid, because it's fine to do. It's not causing you any harm. But to expect that that's going to like fix all of your bleeding problems, absolutely not. And if you really are having bleeding problems, see your doctor. Right. Don't drink lemon juice. Like don't just like pop vitamin C pills. It probably won't hurt you, but it's not going to like fix the problem that you're having. And there may be a really simple solution, or just an exam is needed, or an ultrasound is needed, and you got your answer right before, and then you feel like, okay, like this problem really is being taken care of. So look, I never want to like knock. I know we were going to kind of talk a little bit about this, but I never want to knock alternative therapies. Mm-hmm. Just in many experiences I've had, both personally and with patients, I do think there's a really huge role for it. Mm-hmm. However, we also need to like have the evidence behind it if we're going to recommend it as like solving a problem. But if it doesn't hurt you, right? If it's not going to cause harm, go for it. You can try it. It may not work though. Like remember that.
Right. And I think there's a difference between a problem and I just want a shorter cycle. You know what I mean? Like your cycle is 35 days. How am I getting this wrong? No, your bleeding period is longer. And so
right. It's like 9 days. I want it 7 or 5. Right.
You're not having irregular or unusually heavy periods. Do not
right.
do that at home. Go to your doctor. And if you're having halachic problems, go to your Rav, and there's Taharat. There's so many amazing resources out there. But if it's just, hey, why don't I have that cycle? And you're perfectly healthy and there's nothing wrong and you're seeing your doctor, then try it. And, vitamin C will just be, you'll just urinate out the excess. So.
Right. And I'll tell you, some of these organizations do give the recommendation of, take the bioflavonoids, take the vitamin C.
Mm-hmm.
It's something you want to try 1 month, go ahead. Mm-hmm. But that's not the solution. The solution is seeing your doctor, get a diagnosis, discuss treatment.
Or a problem. Saying that.
But even if it's not even if it's not a problem, like my periods are 9 days and I want them 5 because I want to get to the mikvah. And you know what? Am I having a problem where I'm ovulating, before I go to the mikvah because my bleeding is so long? Okay, that's not something you fix with vitamin C. Right. That's something that, needs to be like calendars need to be looked at, and ovulation and cycle length. Like this is now become, you may not think it's a medical problem, but it may not be a problem. I think that word kind of, puts you into different categories, but it's something that can be worked on, right? We can modify the normal, I guess, in a different way that will be more effective, or identify like, hey, how can we help you get pregnant if you're having really long cycles and you're having, just things like that. I think we almost need to think about it as sometimes everyone's looking for an easy fix all the time, myself included. That's just normal. But I think we need to, especially with our cycles, and I like to say each cycle is a month long, right? Like you can't always fix it on the day to day. You have to think of it as a month. You have to go through a few cycles to see is what you're doing working. And but that's day after day after day of waiting to see if something works. And that is so hard for people. And I think we have to understand that even if we're not happy today, tomorrow, the next day, maybe next month, it'll be okay. And what we're trying to do is working, or it's not working and we need to move on. But it does take waiting. We can't always get like instant, perfect relief right away with especially with gynecologic problems or situations, I should say.
Right. That is amazing advice. And we're going to have to reconvene.
Okay.
We didn't get to
we could talk for hours, right?
Halfway through the list. But this was really, really, it's not just fun for me to talk to you because it always is, but it's so informative. I think it's going to really help a lot of people. So I thank you so much for doing this with me.
Good. Thanks so much for having me.
Good Shabbos.
Yeah, me too.
Thanks for listening to the JOMA Preventative Health Podcast. If you've enjoyed this, please rate and review us on Apple Podcasts and share this with your friends. For more information, check out our Instagram at joma_org. Check out our website, www.joma.org, that's JOWMA.org, or email us at health@joma.org.